Here I am with another 5 symptoms you shouldn't take lightly in adults. Rectal bleeding. Bleeding while you're defecating. This can be due to a simple hemorrhoid, which is commonly known as piles, to the first sign of colon cancer. In hemorrhoids, there will be fresh red blood, which is noted after defecation, bleeding drop by drop, or streaking the stools. There can be a lump or tag coming out of your anus. This usually occurs in people who has long-term constipation or cough, in pregnant mothers, etc. Or it could be a wound which we call as anal fissure. In anal fissure, there will be a sharp pain from the start of your defecation which persists long after the defecation is over. There will be fresh blood streaking the stools, or there will be spurting. Or it could be angiodysplasia. This occurs in elderly people. There will be continuous fresh red bleeding. Make sure that you consult a doctor to stop the bleeding, because elderly are at high risk of going into a circulatory shock, which happens when they lose lot of blood. Or it could be due to cancers. Many types of colonic cancers also can cause bleeding with defecation, so should be alarmed and need thorough investigations. Usually, but not always, in elderly people more than 50 years of age, colonic cancers occurs. It could be accompanied with sense of incomplete evacuation. That means having the desire to defecate even if you have just defecated. It can be also associated with diarrhea, constipation, or alteration between the two. Breast lumps. Breast lumps are not always indicative of cancers, but the most prevalent cancer among women in Sri Lanka is the breast cancer. To detect breast lumps or any other symptoms of breast cancer early, you should have a habit of doing self-breast examination at least once a month. A breast lump of any size, which is painless, immobile, like fixed to a place, hard and rapidly increasing in size, associated with skin changes such as darkening, tethering or wrinkled skin, associated with blood-stained or greeny discharge from the nipple, is a concern. Fatigability. Feeling tired quickly or feeling tired all the time. This could be due to anemia, which is known for low blood level. It's very prevalent in low-income countries such as Sri Lanka because of low intake of iron-rich food such as meat. Other symptoms of anemia are pallor. It's not much evident in dark skin, but you can check your inside of the eyes and compare with another person and see whether it's pale or normal pink color. And shortness of breath. Or it could be due to hypothyroidism, which is reduced thyroid level. The other symptoms of hypothyroidism are tiredness, constipation, difficult to tolerate cold climate, or becoming fat even though you eat less. Another cause for fatigability is heart failure. In elders, heart failure can occur. The other symptoms of heart failure are shortness of breath and swelling of both ankles. Or the fatigability could be due to depression. The most common symptom of depression in Asia is fatigability. Here, people don't have emotional literacy to talk and communicate about how they feel. They are much more comfortable, and it's more acceptable by the society to have fatigability and body aches than being sad and worried. So people mostly present with multiple complaints such as body aches, tiredness and fatigability when they are in depression. Other symptoms of depression are sadness, not enjoying things you enjoyed before, suicidal ideas, loss of appetite, loss of sleep, and lack of hope about future, etc. The fourth symptom is spontaneous swelling of joints. We all know what does this means. Arthritis. There are several types of arthritis. Arthritis is not limited to old age. In a middle-aged person, if the swelling are on small joints in hands and feet, it's probably due to rheumatoid arthritis or a systemic disease called systemic lupus erythematosus. If the arthritis is associated with other symptoms such as rashes in the face which increase with sun exposure, or a headache or urinary problems, please consult a doctor as soon as possible. The final symptom is heartburn or chest pain. Heartburn is very common in young and elderly nowadays. Many myocardial infarctions, commonly known as heart attacks, are recognized and treated as gastritis. Heart attacks can present in variety of ways. If you have a risk factor for heart disease, such as a close blood relative of yours had a heart attack, or you have diabetes or high cholesterol level, or you are in a constant stressful environment, or you are leading a sedentary life, or your age is more than 45, be alert when you have following symptoms. A chest pain which wakes you up at night. A chest pain and you feel very restless. With chest pain you are sweating or having loose stools. Or with heartburn or chest pain you are feeling extremely cold. Or you are also having pain on your neck or left shoulder. Go to a doctor immediately, take an ECG and check it if you had any symptoms with a risk factor. So that's it for today. Please like and share with your friends. Subscribe to stick around for more videos like this. It always means a lot when you do. Thank you.